Record. Hello, good evening, all. Good evening, and welcome to Wellness Wednesday. Oh my God, I actually miss doing it this way. Good evening.
Good evening, Dr.
Oh,
Susan.
it's so good to hear your voice. I miss your voices. I'm so sorry. I miss your voice. How are you doing today, Ma?
Fine. Good.
Good. Good. Good. Good to see you.
Good to see you too.
Thank you. I think some people will still be joining on YouTube link. So I'm hoping my team they have connected them properly for me because I'm only one person. There's so much that I can handle at once. So yeah. Good evening, everybody. Welcome to Wellness Wednesday.
You're welcome. Good evening.
Good evening. So I just want you to know that most people will be joining via the YouTube link because they're already used to YouTube. So even if we have like 10 or more on here, we will get started immediately. So please just bear with me and welcome to, I think I joined, I started 1 minute before time. So yeah. And also today we just have, just to chit chat, ask questions, hang out, and hi Glory.
Hello.
Glory, how are you
I'm fine,
doing?
thank you, ma.
Okay, welcome to Wellness Wednesday. Rejoice, come in. Enter. Bring it. I want please help me with my pen and paper, please. Yes, hi. Good evening, everybody. Welcome to Wellness Wednesday. You see, um, we we are getting started right now. So once again, welcome to Wellness Wednesday. My name is Dr. Susanna. I'm your friend, your health coach, your wellness mentor, and also I'm a mentee because like, on a day like this, I also get to learn from you. Someone asked me what is the greatest success, what has made this program successful, and I said it's because I listen to you, and anything I talk about is based on some question, some explanation, or something that you really wanted to hear. So you've made me successful, and you keep saying, "Oh, Dr. Susan, thank you, thank you, thank you." I want to use this opportunity to say thank you so much to all of you. For those of you joining on YouTube, I'm very happy to be with you this evening. Also, for those of you joining all over the world, I want to say welcome. Yesterday, I got a call from New York City concerning the Wellness Wednesday. Hopefully, the person is going to join. We've been getting people from South Africa, all over Nigeria, every part of Nigeria, Ghana. So the reach is becoming wide. And we just have a very simple message. The simple message of this program is that we can heal ourselves and we want to pay attention to our health, even if it's just one day in a week. We just take and pay attention to what matters most because without health, really, honestly, nothing else feels good. It's not even that pleasant to live on earth if you don't have the best of health. So once again, welcome to Wellness Wednesday. For those of you who don't know me, and I know you all know me, most of you don't, I mean, some of you don't, My name is Dr. Susanna. My academic background qualification for this program is that I have a master's in preventive and promotional medicine. And I also did lifestyle medicine in Harvard. And then, so that's my core background for this program. Sir, you're welcome. It's good to see you. How is mommy? You did not bring mommy to the line. Welcome, sir. All right. So once again, welcome. All right. So for today's program, as you noticed when we sent out the invitation, let me mute all. Hang on. Okay. So for today's program, as you noticed when we sent out the invitation, I did not really have a spell out an agenda. I just came here so that I can listen to you, so that I can take your questions, so that I can answer your questions. For those of you, because I'm actually by myself where I am, if you sent your question on YouTube, I'm going to try to get to it, but if I don't, we actually screenshot, like after the session, all those questions, they tend to disappear. So we are actually taking screenshots of every question, and I promise you 100% of all the questions will be addressed. Number two, if you're on YouTube right now and you have something to say, you have a question, you want to share a testimony, please, you can hang up and join on Zoom if you have the Zoom app already installed, because with the Zoom, it's more interactive. And as you all know, we started the whole program with Zoom, and now we are now mostly on YouTube. So if you're on YouTube and you have something to say and you want to just talk to me, chat with me, you can drop and join on Zoom, and then so we can chat. So that's that. Okay, so to set the evening running, it's gonna be a short, sweet evening. As I said before, the objective of this program is about healing yourselves. So just as a simple reminder, as you are now, wherever you're sitting, whether you're a child or a grandparent, as you are now, your body, what you're seeing here, this is your body that you're seeing, is made up of cells, right? It's made up of cells, and we already know that that is the smallest unit of what is sitting in front of you now, including me. We are made up of cells. So these cells come together to make tissue. So for example, if someone has like a breast cancer and they want to clip off a little bit to go and check if cancer is inside, or prostate, or they say, oh, we're taking a tissue sample, because within the tissue, cells are in there, right? So cells make tissue, tissue makes organ. So it means if you ever want to heal out your organ, you can't think of healing your organ, maybe your liver, your kidney, or your skin, because your skin is your largest organ. I was sitting with someone, a certain lady, and we were talking, and I looked at her face very closely, and I saw like, black patches of dead skin, really dead skin. And she's really huge. And I asked her, I said, do you drink water? My usual question. She's like, I gave up. I gave up a long time ago. Nothing works. So I invited her to this class because at least everybody on this lecture, we understand one thing about consistency and persistency. Please, if you've been drinking that water, you've been doing that exercise, you've been doing this, you did not see, just persist. Eventually, everything will unfold. So I now taught her one or two things. Hopefully, she'll be persistent enough. So the point I was making is that even how healthy your cells are can actually show on your skin. So your cells make your tissue make your organ. What are your organs? Your liver, your heart, your lungs, your skin, your intestine, everything is organ, okay? And then the organ makes the organ system. So just a quick recap. These your cells, all your cells really need to be healthy, as I always say, it's just basic things. It doesn't want to have poisons and toxin around it, so you detox. It doesn't want to have dryness, so you hydrate. It needs some nutrients, so you give it nutrients, of course, and then it needs adequate amount of oxygen, so you give it oxygen. It's just what I live by. So if someone's like, oh, Dr. Susan, you're always energized, happy, healthy, this, that, it's what I live by. And on that note, I want to revisit a book. This book, I don't know if you've read the book, but I revisited the book. And the name of the book is called, well, before I tell you about the book, okay, then I'll leave the floor open for you to talk because I came to hear from you. I revisited a book and I just got a newfound appreciation for how this world, this nature, this God has put everything in place to heal us. And the farther we are away from these things of nature, the closer we are to sickness and even death. Let me repeat that. So take coconut water versus Sprite. They are both sweet, they are both clear, they are both everything. Coconut water heals. Sprite, I don't know what it does. Of course, I know what it does. You understand? Okay, let's say fresh air versus stuck inside the AC from morning till night and the next day and everything, you know? And then with the green plants, if you don't overcook it, put too much Maggi and oil, and you take it medicinally as God intended, you're going to be well, you're going to be healed. So a simple reminder, so this book, I don't know if you've read it, it's called Everything Heals. Okay, if you've not read it, please, you have to have it as a bedside companion. Everything Heals. And if you take it chapter by chapter, it's just a friendly you can read this book and be sick. If you read this book and follow it, you know, because the book did a very fantastic job taking out the medicinal component of what nature has to offer. So things that you would have normally taken for granted, you now see the medicine, the prescription value of something as simple as sleep. You will now see the prescription value of something as simple as God, you know, like God as medicine. You know what I mean? You can see a simple prescription value as, you know, from your water. It lists out different water therapies and everything. It lists out different type of food you can eat to heal, different exercise for different medical conditions. And then the biggest one that I love most is your mind as medicine, which is the last thing I want to talk about. If your mind is not sound and you believe that you're already well, I can give you paracetamol. If you don't believe it will work, it can't work. But I can give you a chalk and you say, Dr. Susan gave me, I believe, my mind believes that chalk will get rid of your sickness. So you also have to be in that space where you believe that you're healed already. No matter what the devil or what is showing up, just be like, you know what? I'm not going to listen to that. I'm healed. And remember, sometimes it takes a little time. It could take a month, it could take 3 months, it could take a year. But trust the process. And by God's grace, you will get your body. So that's just my own little friendly reminder on my usual talk. I did not bring a topic today. I just went back to, you know, how I live, the small things I abide by, whether you're old or you're young, you're a baby, etc. What I am talking about will heal you. So once again, welcome to Wellness Wednesday. I miss you. I miss your voice. So I'm done talking for the night. It's your turn. And if you don't want to talk to me, it will be a really short and sweet class until we take up the YouTube again. Maybe I take another 3 to 4 classes. And then after 3 to 4 classes, then I will now continue So after every 3 to 4 classes, we'll do one-on-one like this. So if you really wanted to have a conversation, communication, be writing it down, and then we will talk once a month or thereabout. Okay. So the question I've started rolling in, the first question I have on this platform is, what are the implications of chronic complication on diabetic patient? Wow, that's a big one. Okay, so someone asked, who is the author of Everything Heals? I'm coming back to that. What are the implications of chronic constipation on a diabetic? Chronic constipation on a diabetic. Chronic constipation on a diabetic. Okay, so let's talk about it. Since this is a very short one, this is a book, Everything Heals, and the author is my humble self, Dr. Susanna Adams. And I think this book, they're still giving it away for maybe, I don't even know the price, maybe it's like 5,000 or 10,000 or so. I didn't come to sell the book. I just came to remind people that a book like this exists. So I don't have I'm sure it's available, but I don't know the exact price or anything. So if I had that in mind, I should have found out the price. So it's Everything Heals. But most people that read it said, Dr. Susan, just the book healed me. So this book actually heals because everything heals. If you believe everything heals, even your hand can heal you. Maybe one of these days we'll teach how to use your hand to heal yourself. So even your hand can heal you. Everything can heal you. It just depends on how you see it. So the first question is, what are the implications of chronic condition, chronic constipation on a diabetic? That's a good one. So number one, to start with, what's the problem of a diabetic? A diabetic, because we have a diabetic clinic, and you know the story, why Dr. Physic exists is because my mom was a diabetic and she was on a ton of drugs, but she wasn't getting better on the drugs until we had to find a way to include lifestyle modification and lifestyle medicine, which is what I now teach. And then, to God be the glory, yesterday I have a video of my mom dancing like this, no man's business. And it brought tears to my eyes because she would have been long forgotten if not for lifestyle medicine. As I always say, there's room for drugs, but if you don't add what is healing you, what is paining me, what is hurting me is that, the way drugs are handed to you, and then this total elimination of including what should be healing you as you're on the drug, this is like my biggest pain point. So for example, you have ulcer already. They say, oh, don't worry, you can take omeprazole, you can take this, you can take that. But did somebody sit down and tell you, like, if you do cucumber, first thing in the morning, last thing, you'll be slowly healing out your gut, and then maybe do a probiotics. It doesn't come. Just take this one. Eventually, they end up on surgery, and I don't like that. So that's why you have to keep coming to this class, keep sharing, keep liking. This message must get to the end of the world. So back to diabetes. Even if you don't have diabetes, you need to listen because anybody can become a diabetic overnight. That is number one. And then in old age, most people will become diabetics. Why? Number one, maybe your pancreas is now weak, as in old age weak. So the sugar will go up. So it's important for everybody to understand diabetes. So what is the problem of diabetes? Diabetes says that you have too much sugar in your bloodstream that doesn't leave your bloodstream to where the sugar is needed most, which is at the cellular level. Let me repeat that. Diabetes just means there's too much sugar hanging out in your bloodstream, and it doesn't leave the bloodstream to get to the cells. So if the cells does not get sugar, it cannot make energy. It cannot heal you. Nothing works. Even the neurons will not fire. Nothing will work. The cells run on sugar. But there's a certain amount of sugar the cells need. But the diabetic cells, sugar is not getting to the cells, just stuck on the bloodstream, right? Now, if you now have that problem already, you're already sending a lot of toxins into your system. You're already sending a lot of toxins to your system.
Let's go downstairs, eh?
Okay, I want to mute all. Yes. Okay. So you're already sending, making a lot of toxins. How? Those cells will start dying because they're not getting sugar. Meanwhile, sugar is in the bloodstream. So the cells start dying. So if you have chronic constipation, the toxins also that sit in your colon, because your colon is the garbage warehouse of the body, the toxins also will be seeping out of your colon and giving you a generalized low-grade inflammation in the body. So this low-grade inflammation is not like it's going to give you fever or body ache or anything. But most of my patients that have a chronic constipation, their sugar fluctuates a lot and it's not regulated. And I believe it's because your body is inflamed and there's too much toxins in your body because of that chronic constipation. So that is the best way I can relate. So another thing is that I also found out that in Dr. Physic clinic, when a diabetic comes and they do colonic hydrotherapy, they clean out their colon. For some reason, the sugar crashes. As a matter of fact, I'll lead you into Dr. Physic's secret. We always have to give you what they call colonics juice to make sure you have some sugar in your body, because we've had incidences when we started where you go into the colonics and you cannot stand up because your sugar will crash to like 2. So that tells us that if your colon is clean and free and not constipated, you will have better sugar control. Lastly, when you're a diabetic, you can have a tendency of having either too much constipation or too much diarrhea. Your GI health is not as good. So I noticed that because some diabetics, when they're very old, always they have these bouts of diarrhea, especially if they're on metformin. Okay. And then I also note that the younger diabetics also, if they're not eating properly and drinking adequate amount of water because they urinate too much, when you're diabetic, you're always urinating. So they don't drink enough water. They can also have constipation. So I don't know if that's the question that the answer you need, but I just have to talk around what I know about diabetes and how it works with constipation and the implications. So if that doesn't clarify, you can ask more questions. Glory, if anybody has a question on YouTube and did not migrate to Zoom, please send it. Okay, so that is that.
ma'am.
So I've answered the 2 questions. Okay. Okay, another question. What am I to do as I don't want to slim down further? I am doing water fasting once a week. Okay, so if you don't want to slim down further, if you want, you must increase your calories, but I want to in calories, and I want to assume you have good kidneys. So that's it. So what am I to do if I don't want to slim down further? If you don't want to slim down further, increase your calories, and the only calories to increase is protein calories. If you increase carbohydrate calories, you're going to become diabetic, get fat, etc. So increase your protein calories. So if you used to eat 1 piece of fish, start eating 2 pieces of fish. Protein is very hard to eat. Carbohydrate is very easy and sweet to eat. You understand? So you can do that. You can still do fasting. I'm doing water fasting once a week. You can still do water fasting once a week, because if you do water fasting will not allow you to have cancer. You will not have cancer, because every clinical study that I have read, people that do water fasting once a week, cannot have cancer. And even if you want to have any other disease on earth, don't have cancer, please. Have another one. We can manage. But that cancer is not a joke. I want to tell you that whether you're a saint or sinner, cancer can come. It's not a sin of you committed some fraud or adultery or something. It just shows up. But we pray against cancer on the lives of every single person on this platform. And God will do it for me. I don't, even if it's brewing, it is gone. You don't have cancer. So fasting will help with cancer. Fasting will help increase your body metabolism. Fasting will decrease aging. Fasting will decrease your chances of becoming a diabetic. Fasting will improve autophagy, which is cellular level detoxification. Fasting it even gives you one other swag like that, where you feel this level of confidence that, you know what, all you people that are saying you're hungry, you're just noisemakers. So I think you should continue the fasting. However, increase your protein calories and maybe fat calories. So you can increase your avocado. You can drink 1 tablespoon of olive oil in the morning, increase your avocado, increase chewing your coconut, and then also do a lot of protein, and you will be looking so fresh and beautiful. Okay. All right. So I don't have another question on the platform. Do we have a testimony? Do people want to talk? Okay. Somebody's asking, what are the symptoms of fat? What are the symptoms of fat in slim, structured human beings? Thank you. So the symptoms of fat in slim, structured human beings is number 1, flabbiness. That is the first one. Flabbiness. You might be slim structured, but you're flabby. So you're not firm. If you're not firm, you have weak muscle and fat. So that is one. Flabby, like you're not solid, like solid mass. Okay. So that is number 1. Number 2, another symptom of fat in a slim person is you have to come in and do a scan. We have very skinny people with fatty liver. So a scan will be able to reveal it. So the fat will not really show, but there are 2 places that it will show. It will show as high cholesterol. As I said last week or week before, thank you so much for asking this question. In Dr. Physique clinic, and I don't mind being audited, there are more skinny people with high cholesterol than fat people. So if you come for like a physical examination, sometimes if we look inside your eye, we can see cholesterol just by physical examination. Only a doctor should be able to do that. So I'm not going to teach how to open your eye and check for cholesterol before you finish yourself and everything. Okay. So there are 3 ways. Number 1, we can do a blood work. We can know. Please, if you're skinny, always come in for a blood work. Number 2, we can do a scan and we can know. Number 3, if you're slim and flabby and not slim and firm, there's a high chance that you have fat. So that is your fat symptoms. And number 4, if your BP is fluctuating, like maybe 100 and it's not that high, like that 130, 90, 130, 90, there's a chance that you've choked up all your organs and you're suffocating. So I think you need to check that out. So that's that. Another person has, how can I add weight? I love this question because last week we discussed it in our clinic that we've been doing a lot of lecture on how to lose weight, but we've not done lectures on how to gain weight. So that's a good one. So how do you gain weight? First of all, don't ever gain weight. What you gain is healthy weight. So let me repeat, you must never gain weight. If you must gain anything, you have to add the word healthy weight, because to gain weight, that one is easy. but healthy weight. And healthy weight is when you climb the scale and the scale is going up, but when we check your body, it's more of the muscle that is increasing and not the fat. So the simple thing I want you to take away is this: anytime you're gaining weight, whether you're a fat person or a slim person, if you're gaining weight and it's coming from muscle, that is a very good weight gain. So there are some fat people that they are going to gym and doing everything, but the weight is just going up. There's a chance that you've even gained healthy weight that will keep you living longer. So don't freak out. But for the skinny people, number one is, I found out that skinny people, they don't like eating too much. They don't even like eating. Some skinny people eat a lot, oh, don't get me wrong. I've seen one, and the person's stomach, I think the person is just long. But some of them, they don't like eating. Now, and I said earlier that the hardest thing to eat is what? It's actually protein. Protein is so hard to eat. So if you used to eat one chicken, you eat one chicken, you eat the second one as a medicine. If you eat one piece of fish, you eat one piece of fish, you eat the second one as a weight gain medicine, etc. Number two, you can maximize how much food you eat in the evening. So, we preach don't eat at night. If you eat at night, you gain weight. So if you want to gain weight, you can actually reduce how much you're eating during the day, and then you eat more at night. But if you want to lose weight, you eat more in the morning and afternoon, and you decrease how much you eat in the evening. So that's how it works. Okay. So I've talked about two things: eating timing. There's these sumo wrestlers, these very huge Japanese sumo wrestlers. They give them a lot of food in the night and they eat and go and lie down. They get very fat. In states like, I think Itagiwa, Cross River State, they have some ceremony called the fattening house, where they give you a lot of things. You eat at night, go and sleep, and the next morning they massage your body, give you more food like that. So they actually have fattening house. So if you want to use the fattening house approach, you will gain weight, but it's going to be mostly fat. So remember, healthy weight gain must be muscle. Another thing, for those of you that think you're skinny and you want to gain weight so that you can impress people who don't care about you when you're sick, sorry to put it like that, is it not better if you're skinny and healthy? Is it not better you're skinny and healthy than gain weight to impress who? Please don't think about anybody when it comes to your health. The only thing you think about is yourself. The only person you think about is yourself. So my recommendation is, for those of you who want to gain weight, eat more of your double your calories, number one. If you don't double your calories, you will not double your weight. Number two, eat more in the evening. Number three, lift a little bit of weight. Lift a little bit, because when you lift weight, your muscle will grow and that will give you a healthy weight gain. So, and then number four, eat high healthy fat. What is high healthy fat? Olive oil, avocado. Well, for Nigeria, olive oil and avocado, there are other high healthy fats. So that is that. So even if you say, okay, Dr. Susan, this, that, even if you did those four things, we will not be having this conversation. But the question is, are you going to do it? That's the main question. So please do that, and then we'll be good. All right. So another question on the platform is this: are you based in Lagos, Nigeria? So the answer is yes. I am a diabetic using lifestyle modification to control it. Okay. And before I finish reading that question, I want everybody to know that sometimes it's a blessing. Oh, God, forgive me for using my mouth to say that. Well, let me not say it. You see, this diabetes thing, right? Some people that if they were not diabetic, they would die faster. I'm sorry to say, because the diabetes helps them eat so much healthier, live so much better, exercise and everything. And in the process of fighting diabetes, they don't know that they're fighting heart disease, fighting cancer, fighting forgetfulness, fighting. Let me tell you, how you fight diabetes in your body, anything you do to fight diabetes is automatically a life extender. Please, somebody should quote me. Anything you do fight diabetes is so better you don't have diabetes and you're adopting the lifestyle of a diabetic is a life extender, it's youthfulness, it's glow method, is everything. So when you hear, oh, diabetic, don't say, oh, these diabetic people again, I'm not a diabetic. You better listen to what the diabetics are doing. Two things. One, so you never become a diabetic. And two, what diabetics are doing to get rid of diabetes is what people without diabetes are doing to live longer, healthier, and a more vibrant life. So it says, I am a diabetic using lifestyle modification to control it. However, I am personnel to guide. I am personnel to guide me. Wait, oh, sorry, I skipped a line. However, I am looking for a medical personnel to guide me. My only belief in the use of medicine, which he kept. Sorry, I'm reading my screen sideways. So because I kept it on landscape, so the question is coming like this. So that's why I'm turning my head and reading like a kindergarten child. Okay.
Should I read it out?
Medicine which he kept on increase. Yes, please go ahead.
Okay, so basically,
I just want to make
like
sure.
I said, I'm a diabetic using lifestyle modification to manage my condition, if I can use the word. My endocrinologist, the person that actually diagnosed me, just his own belief was that I should just be taking medicine. And I kept on, anytime I went back to him, he kept on increasing the dosage, then added more tablets. And I just felt at this rate, I'm going to end up having to take insulin. So I read up a lot on the internet, found out that there was an alternative way. So basically, I'm using, like I said, lifestyle, but I just need guidance. I don't just want to be like, okay, I've been doing this on my own for years now. Before, when I was first diagnosed, I was like my HbA1c was like a 9%. I'm down to 6.2. My aim is to be in the 5% range, which is considered normal. But I just want to know that I'm just not doing this on my own, or I'm making mistakes or things like that. Basically, that was why I was asking if you were based in Lagos. So maybe I could see someone to just further guide me to make sure I'm on the right path. I hope you heard me.
Okay, question. Yes. So the truth is that definitely stop by the Lagos clinic, number one, and see me. And then maybe talk to me a little later. I'm also impressed that you're monitoring your HbA1c and it's down to 6 point something from 8 point something. That is commendable. It's not a joke. Okay. Definitely I can guide you. There are just some basic questions that I have to ask you and check off, to make sure that you're doing that. But just off the back, are you supplementing at all? Like, are you using things like cinnamon, moringa, bitter leaves, or anything like that?
Yes, I do. I supplement. At times I use berberine. At times I do bitter leaf.
Okay, berberine.
Yes, I do bitter leaf juice. It's just now I'm considering doing. I have fenugreek. So I was planning on doing that. So that I've done quite a number of things. So I just don't want to be like doing so many things at the same time. So that
Okay.
because they say if you do too many of these supplements, it also overwork
Can attack your liver
liver.
and kidney, yes.
Yes, but I do fasting. I do 36 hours fasting at times. I've done 72 hours at times. Once a quarter, I do 72 hours fast, water fast. Then I do 36 hours once a week. Yeah.
Okay. Are you on any medicine right now?
I'm not on any medicine.
Okay, not on any medicine. Okay. Honestly, for someone like you, what I could do is if you come to the clinic or you call me later, we can optimize your GI health. Because I found out that when you optimize GI health, maybe include things like probiotics, digestive enzymes, etc., like that. For some reason, the sugar numbers get better. That is number one. And then number two, I'm only saying this so that in case other people can pick what they can do, that does not mean that you can still you should not you shouldn't you should you should that you should still reach out to me after, but it's a general platform and people are picking from it. When you eat, how are you eating? I'd like to also know, are you a breakfast person? Are you on 1 meal a day? Do you eat more raws? What are you doing? Because if you alter even a little, so do you want to tell us how you're eating?
Basically, I do 2 meal a day, and
okay, 2 meal a day.
Like I
okay.
Eat
so today is a Wednesday. Let's take Tuesday. What did you have for breakfast?
Okay, on Tuesday I had I also need to lose weight for that. I've lost, but I'm still not there yet. So yesterday, that I also feel my calorie count is not quite there. But yesterday I had a yogurt bowl which comprised of Greek yogurt with coconut milk, some chai seeds. Then I had it with some almond seeds. Then I had boiled egg with it on the side. That was for breakfast. And then for my second meal. Sorry?
Sir, I want to go downstairs.
For second meal?
What are you doing downstairs?
For my second meal,
what are you going to do downstairs?
I had a foriro with
I'm going to meet my wife downstairs.
Okay, I'm going to unmute yourself and talk again, okay?
Not the only thing.
Okay, so go ahead. For your second meal, you had a foriro?
Yes, with cabbage swallow.
What time?
It's made from cabbage. When you sort of.
What time? What time did you eat it?
Oh, okay. I had it by 6.
Okay.
6
In
p.m.
between, what did you?
I usually don't snack in between.
Okay, so from 6 p.m. till what time do you sleep?
That is the issue now. My sleep is terrible.
I'll tell you what I journaled today. It says, what does it say? It says, no, if you don't rest, you cannot heal. So, the whole idea is a holistic. You see, some people do the eating part very well. Some people might do the exercise very well. Some people might even do the sleeping part very well. But the truth of the matter is that the body is really weird, that we have to do it holistic, because the number one thing that keeps your sugar high permanently is lack of sleep. Because every time you don't sleep early or enough, you secrete a lot of cortisol. So your body's stressed. Whether you're stressed or not, your body is stressed. And that cortisol reads just as sugar. So could it just be that the sleep component is the reason for this? So what I want us to do is that, for everybody, when I'm talking on this platform, I can't give more than 5 minutes, just so that a lot more people can get questions in. Reach out to me. We can just have a talk around it and understand what does it take to heal out a diabetic. And I want to commend you that give you comment your effort that up till now you're not on a whole bunch of medication, and you've done so well to bring that HbA1c from 8.6 to 6.8, which is really, really commendable, because doctors believe that that cannot be done without drugs and insulin, and you have done it. So I will guide you on a couple of things, just give you like a holistic approach, and then we'll now take it from there. Thank you so much for sharing your experience. And one last time, anytime a diabetic asks a question, forget about that diabetes. Just know that if you live the way they live, whether you have diabetes or not, you will live a longer, happier, and more vibrant life. Diabetes needs more protein, you need more protein. Diabetes needs more sleep, you need more sleep. Diabetes needs more water, you need more water. Diabetes needs less carbohydrate, you need less carbohydrate, etc., etc. So it's a serious thing. So thank you so much, Ma. Please, what's your name?
My name is Tope Johnson.
Okay, Tope. So Tope Johnson. Okay, Tope Johnson. Okay, so you reach out to me, and I can give you something step by step, but I'll have to ask a lot of other lifestyle questions. So we put a small care plan for you that you can do from home. Thank you. All right. So does anybody have a testimony? Someone has done wellness. Okay, go ahead.
Dr. Susan, good evening. I just want to take you back
Sir,
a little bit.
I miss you. How are you, sir?
Good evening. Thank you. Thank you for what you are doing for us.
Thank you.
I just want to take you a little bit back
thank
to
you,
the issue of constipation. It's a very sad, very bad experience I had recently. I've been having this problem of constipation, and I've been diabetic for over 25 years. But suddenly, overnight, I just knew that I couldn't sleep, and I was restless. I decided to go and check my sugar level, and I discovered that it was high in the roof. And I went to your hospital, and they had to do this colony for me. And you know, these colonies, I cannot be doing it every time. What can I do to improve the problem of my constipation? Because I drink too much of this water, I will say too much. And I eat a lot of vegetables. I eat a lot of fruits on daily basis. Yes, I still suffer from serious constipation. Thank you.
Okay, sir. So, two things. How is your fiber intake? Just curious.
You say what?
How much fiber do you deliberately take on daily basis? Fiber. How much fiber do you have on daily basis?
I feed on fiber, like the oats I take in the morning. In the afternoon, I can decide to grind it and make it into amala. And in the evening, I may not take anything. Then I take a lot of Greek yogurt too to supplement my meals. So these are the things, apart from the fruits I take. And
which fruits are you taking?
I take orange, I take pineapple, I take pawpaw.
How do you take your orange?
My orange, I cut it open and remove the inside. I eat the shaft completely.
But how often do you do that?
Oh, it's on daily basis, daily. And I do not know whether this thing is equally genetic to constipation.
Okay, sir. So in your own
some
case,
of my children are suffering from it at their young age now.
It could be genetic. If I were you, you can also try the olive oil therapy, whereby when you wake up in the morning, you do either a tablespoon of olive oil or black seed oil to lubricate your gut, and then follow it up with water. So that is one. Let's not go there. The second thing you can do, there's this protein. Sorry, I put it in my protein powder. This fiber drink that gives you no less than 10 grams of fiber, and it helps you to go to the bathroom. So we can introduce that fiber drink. You just put 1 spoon in the morning and drink it. Any day that I didn't have fiber, if I must go and take that fiber drink in the night. It's called fiber drink. Fiber drink. It's made by Nature's Made makes it. I don't know if Dr. Physic has a version of it. I know that if we have it, it will be 100% cheaper than Nature's Made because it's imported, and one small canister is like 30 to 40,000. I'm sure, because I know the ingredient of it, and we can get it raw. It should not be less than like 15 to 20,000 for that quantity. But for now, until I get it to you properly, you can get, is it Nature's Made? You can buy from Med Plus. They sell it in Med Plus, or even in you're in Abuja, so they sell it in H Medics. Nature's Made. So you put 1 spoon inside your water and drink it. That will help you to train your GI tract to have consistent levels of fiber. Consistent level of fiber. I don't know if you understand, because today you have amala, there's no fiber. I'm sorry. Because these oats, when the clinical studies on oat, or the studies on oat were done, it was done on whole oat roll. They did not do that study in Nigeria. So when we now come to Nigeria, we now grind it and make it into a refined powder, and we swallow it. There's no fiber now. The fiber is now soluble fiber, and it's not working like, even if it's working, but that's not what was studied. So I cannot tell any Nigerian that swallowing oat acts as fiber, but if you eat it as Quaker oat, and it's not the overnight oat, is the, I'm sorry, not the 1 minute oat, is the overnight old English version, that one that you have to put inside your fridge, soak it overnight. That
British oaks.
Yes, that old one. That's the one that they found out that when people take it consistently, it has enough fiber to wash away our sins. But all this oat is a waste of time. So we'll buy that Nature's fiber powder, Nature's Made fiber powder. I wish Rejoice was here. Powder, and then we take it, and you just do 1 scoop will give you about 10 to 15 grams of fiber, just 1 small scoop. I promise you that I take it almost every single day, because I know that I don't have time sometimes to get my adequate. So if I look at the end of the day, I've had adequate amount of fiber, I go. But if I see that from morning till night, I did not get my complete fiber, I'll put it in. So, but why you should buy this one is because it will give you consistent doses of fiber long term. Because orange is separate dose, oat is separate dose, so your body needs to be retrained. 2, I don't know if you've already been on what they call a digestive enzyme. Have you done that?
No. No.
Okay, so digestive enzyme patient issue, especially immediately after colonic hydrotherapy.
Okay.
So if you do that and you still have constipation, then we need to really talk, because then it means something else is wrong. Then lastly, there's nobody that had colon cancer that did not have a long-standing constipation. I don't know one. So when was the last time you did your colonoscopy, sir?
Colonoscopy, I did it. It's about 3 years ago.
Okay, so for your age, I think we need to revisit it, okay? So that's all I can say. So, like I said, I
Okay.
can't use more than 5 minutes on a topic, and we only
All
have
right.
5 minutes
All right.
remaining.
Thank you
Sir?
very much.
It's so good to see you. All right, sir.
Thank you. Thank
You're welcome,
you.
dear. Okay. So somebody says, please, how do I eat plantain? Wow, that's a good question. So there are many ways to eat plantain. The first one is that you can boil it very well. You can still eat it roasted. I don't believe too much in plantain flour. I believe that you can carry fresh plantain, put it in your blender, blend it, pour it inside your pot, turn it, it can come to swallow. That one. But I don't like plantain flour. That because there's a lot of they've adulterated it very well. So if you get fresh plantain, blend it, pour it in a pot, be turning it. As you're turning it, it will become swallow. That one is okay. So you can eat it as swallow in that manner. And I also want to add that in the diabetic clinic, we found out that when you blend your plantain with the back, it actually gives you more fiber, decreases sugar into your system than if you don't blend it with the back. So you can put a little bit of the back or green back. That green back is pure medicine. It's alkaline. It's a detox. It's a lot of things. So you can boil it. You can eat it with vegetable. You can blend it. You can. So those are the ways to eat plantain. Another person asks, is psyllium husk okay for constipation? I say yes. So psyllium husk is actually what that powder that I told Oga to go and buy. The active ingredient of it is actually psyllium husk. So, but don't overdo it. If you just do like 5 to 10 grams, that's why if you measure it 5 to 10 grams, that's small. Just say 1 tablespoon or 1 tablespoon every day consistently is better than you do it today, you turn it to swallow tomorrow. The body seeks a little bit of consistency. All right. Another question is, I use oat fiber plus psyllium husk for swallow. Is that okay? Yes, that is way better because at least the oat swallow that was already the oat fiber that was already scattered, by God's grace, you can actually get it back from your psyllium husk. So that's a good combination. I still insist if you want to do swallow, better you do it in the morning and afternoon and never in the night. Don't do swallow system. And if you notice, if you go up swallow for like a week, someone says, hello, our dearest doctor. How can I handle excess gas and excess reflux? Okay. Number one, remember, before lifestyle medicine, preventive medicine, masters in health management, and moving towards this preventive side, I first studied pharmacy, and I have a doctor. Bloatiness and stuff can be very, very uncomfortable for the client. So if you have like a really bad bloating and gas, go to the pharmacy and buy what they call Simeticon. Simeticon. Let me see if I can type it. Where's my C? I'm typing sideways, remember? Simeticon. Oh. Okay, Simeticon. So now, if you go to pharmacy and just say, oh, yes, Simeticon, yes, something like that. If you go to the pharmacy, they will give you something like Gas X, a lot of stuff. But the active ingredient for the active ingredient for, so Simeticon is actually a medicine that doesn't get absorbed into your bloodstream. It only works on the surface of the GI tract to pop out air bubbles. It's called Simeticon, okay? Now, if they give you like 3 gas-related drinks on over the counter, number 1, turn the back, you see the list of ingredients, and then look for the one that has the highest amount of Simeticon, because sometimes they put other things that does not contain bloating and the lay person does not know it. So Simeticon is the only active ingredient inside any of those products that actually reduces gas. That is number 1. That one is bonus because I know that for sure. Then number 2 is try to eat food that does not cause bloating, if you can. So you should also study yourself. There are some vegetable, including broccoli, cabbage, etc., that causes bloating. Then number 3, you can actually go on a fruit fasting for like 2-3 days. I'm sorry, vegetable fasting for like 2-3 days. It will help push away a lot of gas. But obviously, of course, you know that what is going to remove that gas right away is colonic hydrotherapy. So with colonic, what is colonic hydrotherapy? They just use a very tiny straw, put in through your rectum, and put in filter treated alkaline like water. And then there's a way they will massage your colon and your stomach area. All the years of feces as old as 16 years will come out of your system, because those are the things that cake around the colon for many years, because the colon is like a garbage can. So if the colon is not clean, there's going to be a lot of backup. And then, so you may need to just do one major flush and clean out that whole system and then reset this thing. And then I will also recommend that you go buy a bottle of probiotics and start taking for minimum 90 days. So those are the approaches. So I will do colonic hydrotherapy to reset and rebrand your intestine, your colon, and your whole GI health. I will take probiotics. I will do Simeticon in case of urgent emergency. I would avoid food that cause bloating and etc. Someone asks, is there a WhatsApp chat group? Yes, there's a WhatsApp chat group, so we can continue on the WhatsApp chat group. Okay, I will not go if somebody does not tell me a testimony. Let's share now. Has somebody ever done anything wellness that changed your life so that other people, because it's not about Dr. Susan talking, is that I'm sure no matter how small that thing is, and you think that if somebody tries it, it will help the person. Please, can somebody share? And then we will close with that.
Yeah, I want to say something on that.
Go ahead, dear.
Okay. At present, I'm on a 90 days, I don't know what to, will I call it routine or program you place me on? In fact, I feel that that why I'm that interested, so interested is I was told that I am pre-diabetic, so I'm following what the things you told me, eating twice a day, and taking this one day water fasting, taking the protein powder, putting, that's where the Ceylon husk comes in. I mixed with that, take cocoa and all those. So I'm looking forward to the end of I've done up to 2 months now. That's 60 days. Now I'm still on it. So actually, I've been fearing reducing in my weight, because Yes, I've been fearing that. So, with all these water fasted, I just hope I won't be dropping in. I mean, I won't look emaciated, but I'm not looking emaciated. Nobody has complained though.
See, you will not, because you know what? If you're dropping weight, you're only dropping when you do healthy lifestyle like this. What you're dropping is dirty water. That means inflamed water. You were bloated because you had inflamed water in your body. Then you're dropping bad fat. You're dropping toxins. You're dropping bloatiness. That is what you're dropping. So, because you're doing it in a healthy way, in the process of dropping, your skin is glowing, so like I shared in my last lecture that I've actually dropped a lot of weight, and I'm like, where did the weight come from? Me, I know where it came from, Sha. I know it's actually from, I was handling like 3 major things at the same time, moving to Lagos, hustling. Oh my God, I don't want to talk about it. I'm also a human being just like you. We have our zones, so, and all the weight that I've lost, nobody has ever told me, oh, Dr. Susan, you look like you've lost weight. Or then you can't tell because I'm doing it the healthy way. You may not be able to see or tell, but I know that I'm glowing. So it's when you lose weight and you're emaciating and looking sick. That's when people will be like, what happened? So, Ma, I don't want you to worry about losing weight. Please, please, I don't want you to worry. I want you to lose bad weight and be glowing than try to keep that weight on and then keep sickness inside your body. That's all I want to say. I beg you. So don't worry. You're looking very good. So don't shake.
Thank
Don't
you.
shake. Okay. You're welcome, dear. Thank you so much. All right. So to wrap up and conclude, Glory, please help the people that want to join the chat, send them the WhatsApp chat so they can join. Someone said colony should be done quarterly if you want to give that perfect GI health. Quarterly. If you do it last year, it's not a one thing do it all. You have to do it quarterly, minimum 2 times a year for you to have that perfect. It's like cleaning out your garbage can, which is your colon. And it's just water therapy, etc. So that being said, for those of you who joined late, my name is Dr. Susanna Adams, and I strongly believe, and I've seen in practice, that you can actually, with a little bit of persistency and consistency, you can actually heal out yourself. You heal out yourself from your gut. While we are talking colonics, 70% of what controls your 70% of what controls your immunity, like everything that makes you well in this life, 70% is controlled in your gut, in your intestine, in your colon, between your mouth and your anus. 70% of what keeps you well. 70. Hey? So if 70% of what keeps you well is between your mouth and your rectum, right? Then why don't you do everything to make sure that you have a good GI health? So I want to assure you that, like Daddy just shared, our daddy here just shared now, when his constipation went up, the sugar went up. So that immune system, that thing that regulated the sugar, is affected by constipation. And that person that shared that she has a little bit of bloating here and there. I don't care how much you're enjoying health. I promise you that you can enjoy even more. You can enjoy even more. So your health, your gut health is once it's not perfect, you can't have the best of health. And it's all about discipline, nothing else, discipline. Okay, so that is one. Another take home is the fact that I started this lecture by saying, let your mind heal you. Your mind as medicine. Know that there's so many things on earth that God has already put to heal you. So, and that you're not a sickness warehouse. You're not a sickness warehouse. So your mind, just believe I have healing in my body, I have healing all around me, and healing will follow you. Just to add what to take to gain weight. Okay, there's all these groundnut paste, some brown and every single thing, guinea corn and everything. Yes, they have those things and they actually help because they contain a lot of protein, etc. Thank you. Sorry to do that. So that being said, I want to conclude
there's a question on
this
YouTube.
class. Okay, go ahead quickly because the time is past 9. For the sake of others, me, I can stay here till tomorrow, but go ahead quickly.
Okay, she said, I take a lot of water, which makes me urinate more than 5 times before daybreak, and I feel weak during the day. What should I do? And the second question is that we should send the fiber powder picture on the WhatsApp platform.
Okay, so Glory, we'll go ahead and send the fiber platform. I even have one with me here. I'll snap my own and send. So you can help me to post it everywhere. I'll also post it from my end as well. So that's one. The person that is urinating up to 5 times in the night, I am nearly 100% certain that you're drinking a lot of water in the evening. Dr. Physique rule for water is what? Can you answer me? Is what? If somebody knows it, type it here. What is the rule for our water? Is what?
6 before 6 p.m.
Thank
6
you.
bottles
6 bottles of water before 6 p.m. So it means as whatever water you need to drink, you need to do your water therapy deliberately. There was a man that they gave him about 3 months to live. He's actually my dad's friend. He was stuck in a hospital. In fact, they had already given up on him. And guess what? This man decided, I don't know who introduced him to water therapy. And this is what he does. I don't say he should go and do this one, but he is now the healthiest person on the planet, if you ask me. He does his first water at 4 a.m. That's him, or you can start your own at 6. He'll give 2 hours. And that first water is warm, hot water. 50 cl of warm, like hot water. He'll do another water at 6 p.m. At 6 a.m., another hot water. And then between 6 and 8 a.m., he will eat something. And then at 8 a.m., he will do another water therapy. So guess what? He has already done 3 bottles of 50 cl amount of water between 4 a.m. and 8 a.m. So he will do the first water therapy 2 hours after, second water therapy 2 hours, like that. And then he will drink here and there. Then in the evening, once it's 4 p.m. again, he will do the first water therapy 4 p.m., do the second water therapy 6 p.m., and then he stops there. So it means that if we count it, 1, 2, 3 in the morning, 2 in the evening, 4 and 6, that's 5. And then obviously he will drink in the afternoon. He has done his 6 bottles of water therapy. Why wouldn't he be the healthiest person in the whole world? Why? He's not on any medication. I'm not even sure he's on supplement. So, and this is somebody that they counted amongst the dead, not amongst the living. So I want to ask that person that please, do your water therapy. Know that, okay, you know what? I've given myself enough water during the day. Like I said, there's something you can add in your water to maximize how much water stays back so you don't urinate as much. Until I taste it on my body, I'm not going to use my mouth and say it. I have read it everywhere. I want to see it. So once I taste it on a few persons, because you know our own, everything we talk on this platform is clinically validated, is based on patient experience that we are getting from the clinic that we are sharing. So it's 100% authentic. So once I get that, all the people that are drinking water and urinating, they say, when you put this in your water, you will not urinate again. I don't know. I think you should still urinate, but maybe not as much. So that person should start drinking the water and stop drinking water at 6 p.m. Now, if you stop your water at 6 p.m. and then you still wake up 5 times in the night, then maybe they say urinary tract infection. If you're a man, then there's definitely maybe a prostate. So either urinary tract infection, UTI, or prostate health issue, or other issues if you stop drinking your water at 6 p.m. So that is that, okay? All right. So that being said, do you have the fiber at your pharmacy in Abuja? I believe so. I don't know. I'm not in Abuja. I'm mostly in Lagos. Glory, please, you check and see if they have it. If not, they get it from anywhere. Because anything we sell in our pharmacy that is sold in the pharmacy, we sell it for the same price. We can't, overly mark up. So it doesn't matter. If we bring it to the pharmacy, it's mostly for convenience. So Dory will put it on the platform if we have it. So that being said, thank you so much for hanging out with me. I'm not sure anybody was nice enough to me to give me an outright testimony on what they have done that worked, so that other people can hear me. I know that what you're doing is working. But if you don't want to share with other people so they can be well with you, that's your own. Me, I'll continue to share what I see in the clinic. So I guess I will, because of time, I will leave it alone and then we'll start next week. So have a beautiful day and God bless you always. So we'll see you next week. Good night. Take care. And know that I miss you. So we'll see each other very soon. Take care. Bye-bye.
And
Bye-bye, sir. Good night. All right. God bless you all. God bless you all. God bless you. God bless you. God bless you.